But we begin tonight with the blood shortage crisis, putting Metro Detroit's hospitals and patients in a dangerous position. Good evening. Thank you for joining us here at 6 tonight. I'm Dave Llewellyn.
And I'm Carolyn Clifford. Doctors fear if the problem is not solved soon, they will be forced to make really tough decisions. Here's a deeper look at the problem. The American Red Cross Michigan says in many cases there is less than a 1 day's supply of blood on hand, and 1 in 4 hospitals may not have the blood products they need. And that could lead to hospitals making difficult choices when it comes to everything from surgeries to different kinds of medical care. In some cases, it is a matter of life and death. We're learning that if nothing changes within the next few days, we can expect a dire impact on people who live inside our communities. 7 Action News reporter Kimberly Craig shows you just what some hospitals are facing and what we can do to help.
Doctors across the country say the blood supply is critically low. It even forced a trauma center in LA to shut down for hours. Here at Beaumont Health, their supply down to a single day.
We're at a point now where we're pretty much at the lowest we've seen in many, many months.
Dr. Jeffrey Fishgrun is Beaumont Health's chief of clinical operations, and he says if someone needs blood, they're going to get it, but the shortage has them carefully managing the blood they do have.
Right now with COVID times, we are not doing that much elective surgery, so our surgery levels are down. But we still have to look at surgeries that may need large amounts of blood, and can we safely postpone them? Or do we have the blood that we can move forward?
Normally, we like to operate with a 5 to 6 day supply on hand of blood, and currently we only have about a 1 day supply in-house.
Dr. Craig Fletcher heads up Beaumont Health's blood bank. Much of their supply comes from Versity. And if COVID has you avoiding going to donate blood, he says donation sites are operated with safety in mind.
Whenever I go, everyone is masked, everyone is wearing gloves. It's a very safe process. People are socially distanced.
This is the worst situation in my entire career.
And that's saying a lot when you consider that Dr. Robertson Davenport has been the director of the blood bank for University of Michigan hospitals for 40 years.
And if the blood isn't available, a life-saving operation can't be accomplished. We are very concerned right now. We have about a 1 to 2 day supply. And because Red Cross is trying to distribute as much blood to the hospitals as possible, they're not holding blood back in reserve. So there isn't a buffer that we used to have in previous months.
Dr. Davenport says he's concerned that if there's an emergency, it could impact other clinical care.
It could be a woman who's pregnant and having a complication of pregnancy. If the blood isn't there, I'm very worried that somebody may die.
The Red Cross urging people to donate. It's Cynthia Williams' first time.
I saw that there was a need too, that there was a crisis. So I said it's about time I stepped up to the plate.
I feel really good that I can help people.
Very dire circumstances here. We need as much blood as we can.
Could be helping up to 3 patients with your donation. So it's so important just to get out there and try and save some lives.
And we'll have information on WXYZ.com on where you can donate blood through Versity and the Red Cross. In Dearborn, Kimberly Craig, 7 Action News.
Kim, thank you. And if you want to help out during this crisis, there is an easy way to find out where you can give blood. Just go to redcrossblood.org and type in your zip code. It will give you a complete list of blood drives and donation centers near you to make an appointment. If you donate by January 31st, you'll have a chance to win a trip for 2 to the Super Bowl.